The history of thyroid disease stretches back thousands of years, with the first documented cases being goiters, visible neck swellings, described in ancient Chinese, Indian, and Greek medical texts. The gland itself was named by the Greek physician Galen around 200 AD. For centuries, the cause and function of the gland were unknown. A major breakthrough came in the 19th and 20th centuries with the discovery of iodine deficiency as a primary cause of goiter and the isolation of thyroid hormones. Today, thyroid disease is not a binary condition, a simple yes/no, but a spectrum of disorders including an underactive thyroid, hypothyroidism, an overactive thyroid, hyperthyroidism, autoimmune conditions like Hashimoto's and Graves' disease, and thyroid cancer. Globally, it is an extremely common health issue, affecting hundreds of millions of people, with hypothyroidism being one of the most prevalent disorders, making it a significant and widespread burden on public health. Certainly, the primary causes of thyroid disease are diverse and often interconnected. The most common causes are autoimmune disorders, where the body's own immune system mistakenly attacks the thyroid gland. This includes Hashimoto's disease, which leads to an underactive thyroid or hypothyroidism, and Graves' disease, which causes an overactive thyroid or hyperthyroidism. Other significant causal agents include a severe lack of iodine in the diet, which is essential for hormone production, and inflammation of the gland, thyroiditis. Furthermore, nodules or lumps that develop on the thyroid can sometimes disrupt its function, and genetic factors often make individuals more susceptible. In many cases, the exact trigger remains unknown. The early warning signs of a thyroid disorder can be deceptively subtle and are often mistaken for general stress or aging, but they stem from the body's core metabolic functions going awry. For an underactive thyroid, hypothyroidism, the body's engine is slowing down, leading to a cluster of symptoms including profound and unshakable fatigue that isn't relieved by sleep, unexpected weight gain despite no major dietary changes, and a persistent feeling of being cold when others are comfortable. This is often accompanied by mental cloudiness or brain fog, forgetfulness, low mood resembling depression, constipation, and dry skin and hair. In contrast, an overactive thyroid, hyperthyroidism, puts the body into overdrive, creating a state of constant overload. This manifests as unexplained weight loss even with an increased appetite, nervousness, anxiety, and irritability, a rapid or irregular heartbeat that can be felt at rest, an intolerance to heat with excessive sweating, and fine tremors in the hands. A crucial physical sign for both conditions can be the development of a goiter, which is a visible swelling at the base of the neck, or the sensation that something is stuck in the throat. Recognizing these clusters of symptoms is the first critical step toward seeking a proper diagnosis. Fortunately, once diagnosed, thyroid diseases are highly manageable with effective treatments tailored to the specific condition. For an underactive thyroid, hypothyroidism, the primary treatment is hormone replacement therapy. This involves taking a daily oral tablet of a synthetic thyroid hormone called levothyroxine, which essentially replaces what your body isn't producing, restoring normal metabolic function. It's a safe, long-term treatment, but requires regular blood tests to ensure the dosage is correct. For an overactive thyroid, hyperthyroidism, the goal is to reduce excess hormone production. This can be achieved through antithyroid medications like methimazole, which slow down hormone production, radioactive iodine therapy, a common and effective treatment where a radioactive capsule is swallowed, which selectively destroys the overactive thyroid cells, or in some cases, surgery, thyroidectomy, to remove part or all of the gland. For thyroid cancer, treatment often involves surgery followed by radioactive iodine therapy. The key takeaway is that while some conditions like hypothyroidism require lifelong management, people with thyroid disease can go on to live completely healthy, normal lives with the right medical care. If you've experienced any of the symptoms we discussed, please do not ignore them. Consult a doctor for a simple blood test. It could be the first step toward reclaiming your health and well-being. Thank you for watching. Understanding your body is the first step to taking control of your health. If this information was helpful, please like this video, share it with someone who might need it, and subscribe for more health insights. Stay informed, and stay healthy.